Animal Farm, an E&B TV production. No animals were harmed in the making of this film. Good evening, fellow psychology enthusiasts, and welcome to Animal Farm, an E&B TV special. I am your host, Ellerine Carl, and today we are at the farm to explore psychological disorders in our favorite furry friends. With me is a special guest, Dr. Figman Schroyd, a doctor in mammalian psychiatry and an expert in the field of animal psychology. Schroyd, can you tell us a little bit about your work?
Of course. I have been diagnosing animals with psychological disorders for about 20 years now. You're probably wondering, why animals? They cannot talk, but you've forgotten that they can think. Yes, that is true. And we use a technological device called the electroencephalogram to translate the animal's brainwaves to my invention, the animal interpret, and we can see in words what they are thinking. We use the DSM-5 to then decide what psychological disorder they are in fact suffering from, and we diagnose them according to the 3Ds, which are deviant, distressful, and dysfunctional.
Wow, that's pretty impressive. It's almost as if you've just revolutionized the field of psychology.
Yes, well, basically. I mean, I am the great-grandson, twice removed, of the legendary Sigmund Freud. What would you expect?
Well, I guess nothing less. Anyways, Schroyd, we're here at the farm to test your method on some animals and hopefully improve their lives for the better.
Yes.
Well, I don't think there's anywhere better to start than at the goat barn. Let's go at it. Get it? Like, go at?
No.
Well, we'll be back after a short commercial break.
Buy this stuff. Everyone's doing it.
Cole, when you turn into stuff, because everyone's doing it. Your friends are doing it. You're not going to be cool if you're not doing it. Just do it.
Welcome back, everyone. We are here at the goat barn with Dr. Schroyd. We're about to meet with Aphrodite. Ever since she turned 1 year old, which is about 18 in human years, Aphrodite has been extremely paranoid, unable to leave the barn. She is rarely calm, always twitching her head and body. Sometimes during the day, she calls out as if another goat is baaing for her, even though there is none there.
It appears that the goat has schizophrenia, but let's hook up the EEG just to make sure. The Annie interpret will then turn the goat's thoughts into words. Shoot.
Let me just hook it up here, and then we can look inside her brain.
Thank you, Ellery.
What's happening? Why?
Hey, kick the doctor.
What? Don't do that. No, that's terrible. The doctor's good. No. Hey, kid. She's evil. She's evil. Get away.
But no, I'm not. I just want to eat the hay.
Oh, look, there's a goat. There's two goats.
No, there's not.
There's goats right there.
What are you doing?
You have to go over there.
No,
go,
you don't.
Go to the goat. Stop it. Walk to the goat.
What are you doing?
No.
There's the goat. There was a goat right here. Where did it go? Where did the goat go?
Yes. It does in fact seem that the goat has schizophrenia. It seems that my hunch is right again. My suspicions are confirmed. This goat's behavior is deviant. This is clearly not the behavior of a normal goat. The goat is distressed. She shows signs of anxiety and alarm because of the hallucinations and voices. She experiences frequent panic and constant confusion. The goat is dysfunctional because of the behavior. Her thoughts are inhibiting her from acting normally, eating and drinking. I officially diagnosed the goat with schizophrenia.
So what do you suggest for treatment?
Well, according to my notes and checking the DSM-5 after we have correctly diagnosed the goat with schizophrenia, it seems that antipsychotics would do the trick. It will suppress her overactive dopamine receptors in her brain, which are in excess, like more than a normal goat brain. And agitation and hallucinations should go away within a few days. And delusions should clear up within a few weeks.
Wow, I'm really glad that you were able to help this goat.
Me too.
Well, I guess we should get moving along.
That is correct.
Moving along to to
Please
the
stop
cow barn.
it. Please do not make these jokes anymore. And who do we have here?
This is Aaliyah. She is a 2-year-old heifer, which is equivalent to about 20 in human years. For over 2.5 weeks now, she has had no interest in alfalfa, which is her favorite food. She is also not interested in grazing in the field with the other cows, and has been seen running into barbed wire fences on purpose.
Well, let's attach the EEG and try to figure out what is going on in that bovine's brain. So bad with these things. No, come back. Come back, bovine friend. There we go. Oh my goodness, look, you look so cute in pink.
Oh, I'm so tired. I'm so worthless. I'm not good at anything. Hey, Leah, we haven't seen you in a while. Want to come hang out? No, I'm tired. Are you sure? Yeah. You guys don't like me anyways.
It seems that my hunch is right again. This cow has major depressive disorder, and she has exhibited symptoms for over 2 weeks. She is deviant. Her symptoms are more than just occasionally feeling down. Isn't that right, baby? She is distressed. She feels worthless, lacks confidence, and is lethargic. She is dysfunctional. She thinks of killing herself and has tried to do so. And the disorder interrupts her daily functions, such as eating and sleeping. Just like schizophrenia, major depressive disorder can be found on axis 1 of the DSM-5.
How can Aaliyah recover from depression?
Well, there are a variety of options. We can prescribe some antidepressants that will raise the level of norepinephrine and serotonin in the brain to elevate her mood. I also suggest cognitive therapy, which could change Aaliyah's way of thinking about herself, so she has a positive self-image and an internal locus of control, as was suggested by the great psychologist Carl Rogers. As a last resort, I recommend electroconvulsive therapy, which can relieve symptoms of major depression.
Wow, it looks like there are many options to help our friend Aaliyah. She definitely has a bright future ahead of her. Well, let's get on our way over to the pig pen.
I cannot even right now, okay, girl?
Hello everyone, welcome back. We're here at the pig pen, and here is Dr. Schroyd.
This is Eduardo and Ricardo. I suspect that Ricardo suffers from ADHD. I can see the hyperactivity, the impulsivity, it's all there. This pig definitely has symptoms of ADHD, which is attention deficit hyperactive disorder. Can you not see how he darts to and fro? He is restless and fidgety, always forgetting what he did last. Linda? Come here, pig. Pig, let me love you. Pig! Pig! If pigs were forced to take turns or share in a social setting, Ricardo here would be unable to. The rates of ADHD in his generation have quadrupled in the last decade, and this pig is part of a now 4% of the population suffering with these symptoms. But let's check to make sure.
I'm going to try and attach the EEG to the pig, but due to the pig's hyperactivity, this may be difficult. But we're going to try it out and see.
Pig, 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 I'm a pig. Pig, 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 pig. Hey, Eduardo! Eduardo! I don't remember. Hey, you know what sounds really good? A bacon cheeseburger. Yeah! Woo!
Wow.
As you can imagine, Ricardo's symptoms are deviant, unlike that of a normal, run-of-the-mill lazy pig. They are distressful because Ricardo is in a constant state of hyperactivity. His body gives him few breaks to stop and sort out his thoughts. And finally, dysfunctional because Ricardo cannot focus on much of anything. Even though he is just a pig, Dr. Freud, what do you
It is Schroeder!
What treatment.
Any good doctor could see that this pig is in need of either Ritalin or Adderall, two stimulants that aid in attention and focus. Additionally, and ironically, caffeine helps the ADHD brain calm itself. That should do the trick for this dirty pig.
Let's swim on over
No.
to the fish tank. Hello everyone, we're here at the fish tank. This is our fish, Carl, and we're going to take a look at his symptoms.
All right, let's hook it up. The symptoms are all there. Social separation, anxiety, flashbacks. Our friend has PTSD. Now, you could diagnose or suggest group therapy or cognitive therapy, but I think the best remedy for our fish friend Carl here is simply time.
Wow, post-traumatic stress disorder. That's some pretty serious stuff. But I'm glad our dear friend Shroyd was able to help Carl. Time does heal everything. Time surely does. Well, I guess it's time to head to our last animal, Lucy the dog.
Yes! No puns!
Hello everyone, we're here with Lucy the dog, and we're going to take a look at her symptoms.
Unlike PTSD, which is an anxiety disorder, it seems to me that Lucy has a personality disorder. Antisocial personality disorder. She does not enjoy social interactions. Come here, Lucy. Come here. Come. She is aggressive towards humans. Hello, Lucy. Let us be best friends. I guess not. And in general. Let us use the EEG, just to be sure.
What do you suggest for Lucy?
First, I suggest the cone of shame, because she is a danger to society.
Cognitive therapy has recently been applied to antisocial personality disorder. However, the patient must actively want to participate in this type of therapy for it to be effective. Well, thank you for joining us on today's episode of Animal Farm.
Giving you all the information you need to diagnose the cycles in your life.
Just kidding.